Hey, it's Jeff again, the other Jeff Johnson. Thanks for stopping by the channel. I wanted to update you on my latest visit to MD Anderson for a follow-up. This actually ended up being my almost 2-year return visit post-treatment for squamous cell carcinoma of the base of tongue, HPV 16 positive throat cancer. Throat cancer is the easy way to say all of that. But I had treatment in May and June of 2018, and I went back on May 21st and 22nd of 2020 for my nearly 2-year follow-up. This was scheduled to happen in March of this year. It was supposed to be like a 1 year and 9 month, 1 year and 8 month, something like that follow-up. But it ended up being postponed a couple of times because of COVID-19 and Houston, Texas being a hotspot. MD Anderson asked us to forego any non-essential visits there for a little while. So had this visit. I want to tell you a little bit about what all happened, and then we'll talk a little bit about more general things. But first of all, the best news is that I had my CT scan, and for now every CT scan that I've had, I am still no evidence of disease. From the first one post-treatment up until almost 2 years out, no evidence of disease. And that means, according to a lot of research that I've done, that I am now less than 50% chance of a recurrence. This cancer, squamous cell carcinoma that is HPV 16 positive, there's a good side to it in that it is comparatively easy to treat and easy to kill. The bad side to it is that it has a very high recurrence rate. But if you make it 2 years with no recurrence, your chances of the cancer coming back drop significantly. They will not use the word cured until 5 years out with this cancer, but they're still saying no evidence of disease. As a matter of fact, my doctor said that my scans were, quote, so clear they were boring, unquote. I've never been so happy to hear the word boring used to describe me or anything about me in my life. Still experiencing the dry mouth. We'll talk about that in just a little bit. So, CT scans are clear. I also had a modified barium swallow. This is where they give you some low-level radioactive material. Some of it's liquid, some of it's thicker liquid, some of it's pudding, and then pudding with crackers in it. And you drink or eat these, and they take a motion x-ray of your neck to see how you are swallowing. Nothing has really changed significantly in the way that my swallow is working and not working properly. I have, as I mentioned before in videos, a little pocket in my throat. This would be the front of my throat. This is the back of my throat, so it's kind of like this. That's where the food's supposed to go. And I have this pocket. Most of the time food hits the back of my throat and goes down my throat. Every now and then it hits the back of my throat and ricochets off into the pocket. When it does, it feels like I'm strangling, but they've shown me the video before and I know that I'm not strangling, so I don't freak out anymore. When that happens, I just clear my throat, swallow again. Sometimes I have to wash it down with a little bit of liquid, but I'm usually able to get it down. What they did find that is a bit disconcerting is that there is some fibrosis or scarring in my throat. Now, this is very natural. When you have radiation, there's scar tissue. The issue here is that there is scarring all around my neck, and it causes this to get stiff and get hard and to bulk up and to be inflexible. And it also can cause problems with the function of my carotid arteries, which you kind of need those to stay alive. So they are recommending that I visit with a speech pathologist here locally to have what's called manual therapy. And my understanding of this is that it's kind of a combination between physical therapy and massage therapy, where they will go in and break up this scar tissue in my neck. They've also given me some exercises to do, some fun things where I do like this. And I do that 10 times and hold it for 10 seconds. That's uncomfortable. I've been having some cramping, rapid onset cramping, like you'll get a cramp in your calf. I've been having some cramping in my neck, and I have pain anyway because I have degenerative disc disease and a lot of damage all up and down my spine, but degenerative disc disease is pretty rampant, and arthritis in my cervical vertebrae, so there's already some pain there, and this just kind of adds to that. So yippee hey, one more issue. But in addition to that, let's see, talked with my medical oncologist. This is the oncologist who's responsible for your immunotherapy or chemotherapy. I had both. And I have, over the course of the time after treatment, developed a heart condition. I have two heart conditions, actually. One's called premature ventricular contractions, and the other one is called non-sustained ventricular tachycardia. Ventricular means the venous or vein side of the heart. But essentially what's happening, what it looks like to the machines, is that my heart rate drops down really low, and I feel that. I feel it when it's just almost like, and I feel very tired when that happens, and I can actually feel my heart beating hard and slow in my chest. And then sometimes it would shoot up very high to up like 148, 150 beats a minute. They had already, my cardiologist, I've already had a heart cath. I've had all of the tests that you can do for that. They couldn't find anything wrong. And so they put me on medication. It has controlled the spikes. It's keeping it from spiking up much above 120 or 130. It's not controlling the dips. It's still dropping down to 45, 40 beats a minute, which they tell me it's not life-threatening. He says a half dozen times I'm not going to have a heart attack. So I'm not really concerned about that, but I did want to know what was causing this and if there's something else we can do for it. So I talked to my medical oncologist about it. She said she did not believe that it was damage from the chemotherapy. Slim chance it might have been damage from the radiation, but most likely what has happened is for a significant period of time, for nearly a decade before my cancer was diagnosed, I was overweight, and not just a little bit overweight. I was a pretty heavy dude and had high blood pressure, but didn't know that I had high blood pressure for the first several years that I was overweight. Just never got it checked, and it never produced any issues. And it's quite possible that there was some damage to my heart from having high blood pressure for that length of time, and that the additional stress of everything that has happened with my allergic reaction to an antibiotic several years ago that caused heart attack-like symptoms, and now the stress that was put on my heart with chemotherapy and radiation, and the stress from being diagnosed with cancer and everything else, that it is possible that that has all compounded to produce this heart issue. They don't really know. What they do know is that the medication is controlling the spikes, which are the more important thing to keep under control. And so for the time being, I just keep taking the medication and we'll keep monitoring it. And then there are my teeth. I don't like my teeth. My teeth have been crooked forever. I had braces when I was a teenager, but I did not get a retainer. And so the space that was between my two center top teeth is now off to the right one side. And because of my paranoia about the appearance of my teeth, I have always been overzealous in brushing my teeth, and so I've actually damaged my own gums by brushing too hard. So I have some recession. It's not the right word, but anyway, receding. My gums are receding. And radiation causes the bone structure to weaken, so my teeth are weakening. I'm taking fluoride treatments every day, fluoride gel trays that they give us. But they said, I really need to go see a dentist, but don't. I was like, okay. They said until the COVID-19 thing is significantly more over, safety procedures are in place and tested and everything like that, that oral cancer patients should not go see a dentist. Basically anybody with a compromised immune system, but they specifically said don't go see a dentist yet. So I really do need to go see a dentist. My teeth are in horrible shape and they look horrible. Hopefully you can't see it from here, and I'm not going to get close to the camera because I don't really want that, saved for posterity. But this is where I am right now. So no evidence of disease. Scans look great. Barium swallow says the pocket's still there. There's fibrosis or scar tissue hardening in the throat. We're going to do some therapy for that. The heart condition is not caused by chemotherapy, and I need to get my teeth cleaned, but can't do it right now. The other thing they did that was unique this time, they did not tell me when to come back. I'm hoping I'm going to go to a 6-month schedule now. And I just want to throw this in here at the end. MD Anderson was comparatively empty to what it has been like in the past when I have been there before COVID-19. Now they have checkpoints set up and screening, and you cannot go in unless you have an appointment, or you are the parent of a minor who has an appointment, or someone who has some medical condition that keeps them from being able to function on their own. If you're a mobile patient, as I am, and have reasonable cognitive abilities, and my family might argue that. But if you're able to function on your own, you're going in by yourself. So I don't know if it's just the fact that there aren't visitors and family there, or if there are that many fewer patients, but it seemed like that there were significantly less than a fourth of the people that are normally in the building. And I was there weekdays, Thursday and Friday, when it's normally covered up, every chair in the waiting room, somebody sitting in them, and it wasn't. The place felt empty. Didn't have to wait for much of anything, which is also, unusual when you're going back for follow-ups, because everything's geared toward the people who are in treatment. They get taken care of first. I will say this. I do want to share this with anyone who is receiving treatment from MD Anderson, which of course I hope you never need, but if you ever get cancer, and especially any kind of unique cancer like this, I would strongly suggest that you go to MD Anderson. When you're going back for your follow-up visits, either your initial visit or your follow-up visits, when you're just staying a day or two, not when you're there for treatment, but when you're just staying a day or two, stay at the Rotary House on the MD Anderson property if there are rooms available. You're going to see the price and you're going to go, whoa. It is more expensive than hotels less than a mile away. It is worth it for a couple of reasons. Number one, you can park on property, and parking is $10 a night. I don't think there's anywhere in Houston that parking is $10 a night. Maybe $10 an hour, but not $10 a night. The other thing is you can walk across the sky bridge, one of two sky bridges actually, to MD Anderson. You do not have to go down on the street. You do not have to drive your car from your hotel and then pay to park at your hotel and then pay to park at MD Anderson. And double pay for parking and all of that. It is worth it. They have a great restaurant there in the hotel. They're currently doing carry out only, but you can go in. You can even go to the buffet. They serve everything to you, but you don't touch the food. But they have a menu. They have a buffet. They have a sandwich shop. They have a little kind of a grocery store market kind of thing. So you have a lot of options for being able to eat right there on property. I was literally able to drive from my home, stop about midway for fuel, drive straight into MD Anderson without stopping anywhere else in Houston, stay, do all of my appointments, get in the car, and drive back halfway home before I stop to fuel up again. And no disrespect whatsoever to Houston. Please don't be offended if you live in Houston, but it's a COVID-19 hotspot right now, and I did not want to stop anywhere in Harris County. Not because I don't like you folks, just because I have a compromised immune system and I don't want to get COVID-19. So the Rotary House is an incredible option. Even when this COVID-19 thing is over, when I go back for my, whether it's every 4 months or every 6 months, and even I'm supposed to go back once a year for life, I will stay at the Rotary House from now on if there are rooms available. It's too nice and too convenient, and the balance of not having to double pay for parking, to me, you might spend $20 or $30 more a night. And if you don't have that, I understand. But if you do, it's well worth it for the overwhelming convenience of being right there, knowing you don't have to get up 2 hours before your appointment, that kind of thing. So anyway, progress. We're 2 years out of treatment and no evidence of disease. That's the best news that I've gotten about my health condition in a long time. Thank you so much for your prayers and your kind words on the Facebook group, Let's Kill Fred. And Fred was my tumor, by the way. If you haven't watched any of the other videos, I named my tumor Fred for feeble radiation-eating disease. I deal with stuff with humor. It's just kind of the way I function, folks. So again, thanks for tuning into the channel. If you have a question or comment, please feel free to leave that below. Now, if you leave medical questions, I'm going to refer those to the fine folks at MD Anderson, because I am not a medical professional. I don't want to play one on YouTube, and they saved my life, so they're really good at answering those kinds of questions. They do that every day for lots of people. So yeah, MD Anderson, I'm kind of fond of them. Thank you again so much. And again, as I'm just thinking about Memorial Day, my dad was a World War II veteran. He made it home. He did not die in combat. I don't know that I have anyone in my family who died in combat. I have several generations of veterans in my family, and I'm an Air Force veteran. But I do know some folks that didn't make it back from various places. And I think in the midst of all of the turmoil with COVID-19 and presidential elections coming up and all of that, we forget just how free we are and just what great a price was paid for that freedom. And with that, I'll say thank you again. God bless you.